The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 In Focus.
Hello, I'm Susan Shapiro. Have you ever wondered what you could learn about your health with genetic testing? WellSpan Health is offering no-cost genetic testing to determine potential risk for heart disease and some cancers. The Gene Health Project is a nationwide project, part of ongoing research. Tonight, we talk with some of the healthcare professionals involved with the project and a patient who benefited from it. We're putting genetic testing in focus. Joining us now is Dr. David Kahn. He's the co-principal investigator for the Gene Health Project at WellSpan. Thanks so much for being here.
Thanks for asking me.
This involves genetic testing. Just simply, what is genetic testing?
Genetic testing looks at DNA, and DNA, we all have DNA in each cell in our body, and the DNA makes proteins. The proteins make us who we are, determines our hair color, determines whether we'll be healthy or not healthy. And DNA testing is done by collecting a sample of either blood or sputum, and complex machines are able to sort out whether the genes are normal or abnormal.
So these are detecting abnormalities on the genes?
And normal genes, both.
So why did the hospital health system get involved with this gene project?
Well, this is an entirely new way of approaching preventive medicine. In the old days, patients would come into the office and you would think, I wonder if this person has this disorder. Now, we are screening large populations and finding the disorders, so that we have so far 30,000 people have signed up for the project. We have found 400 genetic variants, and that's 400 people that otherwise would have gone undetected, and we would have learned about their disorder when they came in sick. Now we know about the genetic abnormality, which will enable us to do more aggressive screening and more aggressive preventive medicine.
How many diseases, and what are some of the diseases you're looking for?
Well,
or the risk of those diseases,
the study,
I should say.
It's a large research project, and we hope to collect 100,000 samples, and each of us has 23,000 genes. So if you think about 23,000 times 100,000, and then there's 15 other hospital systems in the country, it's an enormous amount of data. And our hope is to be able to make startling discoveries with all that data using high-speed computers and artificial intelligence. That's one part of the study, drug discovery. The other side of the story is we're reporting back on common genetic problems that cause common diseases, like familial hypercholesterolemia, where patients have very high cholesterol levels, hereditary breast and ovarian cancer, commonly referred to as BRCA1 and 2.
The BRCA gene, right?
Exactly, which puts people at risk for breast and ovarian cancer. And then there's a third one called Lynch syndrome, which puts people at risk for a variety of cancers, most commonly colon cancer, but other cancers too. So far, 400 people we have found that have one of those different genetic variants, and that's going to enable us and the patients to do great prevention.
So this involves, as you said, blood or a blood sample.
Right.
And how much blood's taken? Where does that go? And who's doing the research?
We're in a partnership with a company called Helix, and they're in California. Volunteers can either donate one small tube of blood, even when they're getting their regular blood check, or a sputum sample, and it's sent to California, and about 8 weeks later we get a report back. The report talks about hereditary factors like why you like cilantro or why you have straight hair. I learned that my grandparents were from Finland, or my great-grandparents were from Finland, and people seem to be very interested in that. But we also report back on those three, they're called CDC Tier 1 diseases that I mentioned, and that's the other half of the study. One side is research, hoping to make great discoveries. The other side is the clinical side, where we hope to prevent an enormous amount of disease.
All right, well, stay with us. We're going to talk more about how people get counseling for this genetic testing, which is certainly important, when we come back.
This is WGAL 8 in Focus, coverage you can count on.
Joining us now is Crystal Elwood. She's a nurse who works in the cath lab at WellSpan York, and she also took part in the Gene Health Project. Thanks for being here.
Well, thanks for having me.
What prompted you to take part in this?
So it's been a couple years that my dad was diagnosed with pancreatic cancer, and through his diagnosis, they did a BRCA mutation test and found out that he had positive for the BRCA2. So that then prompted them to have them reach out to like his daughters because we would then have a 50-50 chance of having that gene mutation as well.
Which is also a marker for ovarian cancer and other forms
Yes,
of cancer.
yep.
So that made you decide to, when this came along, to take part?
So I was like, oh, I should get that done. During that time, it was like right after, ended up getting COVID, kind of went in the back pocket, kind of forgot about it. Into one day I saw on the WellSpan website that they were doing this Gene Health Project. And so I was like, serendipity, I should probably go ahead and get that.
So what was that like? You did a blood sample?
Yeah, so I got on, logged in, and you know, you had some consents. You signed up for a blood sample. I went to my local lab, one little tube. They sent it off, and then it was probably about like a month. Then I got some of the testing back.
And what did you find out?
So there's one part that kind of tells you like if you're going to have like curly or wavy hair versus straight hair, if you tan versus burn. So those were kind of neat. And then a few weeks later, then I received a phone call that was stating that I did indeed have one of the positive markers of being positive to, or for the BRCA2, that I was positive.
What was it like to hear that news?
It wasn't completely surprising since I already knew through my dad and that I would have like a 50-50 chance. But, you know, I felt like then now I have information, I need to do something about it, so.
I know, did you hesitate at all taking the test or not so?
Not taking the test, no. I got that taken right away.
So what kinds of measures are you going to take now?
So I met with a genetic counselor over a Zoom meeting. She kind of went over all the different, you know, percentages of what a normal person per, you know, if you had the mutation for like ovarian cancer, breast cancer, melanoma. So after getting that information and everything, I recently had an appointment with the oncologist team to try to make a better, you know, plan for my future. So they talked about, you know, having the total, you know, mastectomy or doing therapy through medicine to try to keep, you know, the hormones down. And then the other one, obviously, because of not having much screening for ovarian cancer, was to have a total hysterectomy.
So you've decided to do that?
So then that prompted me to meet with the, you know, the gynecologist, and I have a total hysterectomy coming up.
And you're young, you're 42, but you have 2 children.
I do.
So obviously
yes.
you feel pretty good about it?
I do. You know, if it's kind of like a crystal ball looking in the future, so I got that. So I kind of look at it as a blessing that, hey, look, we can take this chance, you know, and you can get a total hysterectomy and then have, you know, a higher chance of not getting cancer. So that really prompted me to go ahead and make that.
I know, it's all a little scary, but you decided not to have what's considered a prophylactic double mastectomy, as you've heard some people do.
Right, and we went over all those. However, with the screening for breast cancer, you know, it's a lot more involved. They have AI that's now even prompting radiologists to take like look, you know, even deeper. So the plan was just to have me, you know, follow with the yearly mammograms and then every 6 months with an MRI.
And there's certainly more treatment for breast cancer than for ovarian cancer.
Right, exactly.
At least good treatment. Oh, well, we wish you the best of luck.
Thank you.
I hope it all goes well. And as you said, it's looking into a crystal ball, so it's some good information. Thanks for sharing your story.
Thanks
we appreciate it.
me.
And coming up, we'll talk to that genetic counselor about how they counsel patients in this project.
This is WGAL 8 in Focus, coverage you can count on.
Joining us now is Amanda Matchett, who's a genetic counselor at WellSpan. Thanks to you for being here.
Thank you for having me.
You know, a lot of people might find this kind of scary. They don't want to know this kind of thing. Do you find that?
We do. We have patients that don't want to know about their genetic makeup because it can be scary. You can't change your DNA, so a person was always born with this. But yeah, it can be very scary information. It can be life-changing, so we do have people that don't want to know.
Yeah, which is okay, I guess, if that's the way
their decision,
you want to live. But what do you think is good about knowing this kind of thing, especially if you test positive for the BRCA gene or other genes that could predispose you to cancer risks or other disease risks?
Yeah, I think you have a better idea of what your risk is, because a lot of people don't know what their risk is. We have certain computer programs that can help figure that out, but a lot of times we don't know. So participating in something like this or figuring out about your genetic information can help what those risks are, and then based on those you can do preventative things or extra screenings, so it really does help with risk.
So when you meet with a patient who has obviously gotten some results and tested positive for something, what do you go through with them? How does it work out?
Yeah, so we first go through their personal and family history, so kind of understanding what they've already been doing as far as screenings. We go through family history, kind of getting who in the family has been diagnosed with cancer, and then we focus on the risks and recommendations. So we do talk about the genetic testing and what exactly that was, what it told us, and then we go through the specific risks based on the gene, because there are different risks. And then we go through the recommendations, whether that be increased screening or preventative surgery. And then we also talk about who else in the family might want to consider testing. Which
we heard, a complete hysterectomy. It might be the way to go if you've tested positive for the BRCA gene.
Yep. Definitely. Yep.
Now, obviously, you can't have your pancreas removed, but what could you do for, the other things that you hear you might be at risk for?
A lot of times, at least we can do increased screening. So, like Crystal mentioned, you can do mammograms and breast MRIs for breast cancer. There's MRIs for pancreatic cancer. So a lot of times there is increased screening. Sometimes preventative surgery might be the best option.
And I'm thinking maybe you'd be more attuned to possibly subtle symptoms that you might not think about.
Right, yeah, definitely. Especially like women when they're doing like a self-breast exam, they might notice something a little bit different that they might not notice before.
Do you think there's any reason not to get genetic testing?
I think there always is going to be some reason, whether that be anxiety surrounding the test results. A lot of times that's what we hear, and people just might not want to know that information. But like we've said, it can really help understand what your risks are. In our world, we deal with cancer, so knowing what your cancer risks are, because there are some individuals that don't have a family history of cancer and they have a genetic mutation that now increases their risk. So can help with that.
What about anonymity? You might not want your insurer to know about this or your employer. How is that protected?
So there was a law that was passed, it's called GINA. So it protects health insurance and employers from using your genetic information to make any decisions. So they cannot even ask for that information.
So that's not something you have to worry about.
Correct. Yep.
All right. Well, thank you so much. Very interesting. And stay with us. We're going to join everybody together and talk a little bit more about this.
This is WGAL8 in Focus, coverage you can count on.
We continue our discussion of the Gene Health Project at WellSpan with all of our guests. Dr. Khan, who is this open to?
This is open to anybody that's 18 years of age or older that hasn't had a bone marrow transplant. And we have people in Pennsylvania, and we also have people in Maryland that have been tested.
And it's free of charge?
It's free of charge.
And the genetic counseling that goes along with it is as well?
Yes. Yep.
Now, do you do counseling for everyone who goes through this, or is it just for people who test positive, so to speak, for something?
We are only seeing the people that test positive. So it is offered to the patient. They don't have to accept a referral to us, but I think we've seen a majority of people that were identified to have a genetic mutation.
And you said you're looking for 100,000 people to participate. Why so many?
Well, the more data we have, the more prevention we'll do, and the more discoveries we'll make.
Oh, that's so interesting. Do you think Crystal is, not that you're her doctor or you're someone who would do this surgery, but do you think she's taking the right step in terms of prevention?
I think Crystal should do what Crystal wants to do. We've given her the information. The genetic counselors are wonderful in explaining that. They spend a lot of time going over everything, and then the patient has to do what's in their heart. And it seems like you're doing what's in your heart, which is great.
What would you advise, Crystal, other people who might hear this and be considering it?
I think if it's no cost, a little blood can really, path you a different future. You can find out if you're at risk of one of these cancers, and to be able to get a treatment and get it, taken care of before it's something that you have to worry about. I suggest everybody to sign up.
But as we talked about, even though she's going to have, a hysterectomy, screenings are still important, correct?
Absolutely, and we send a letter out every 6 or 12 months saying, just because you had a negative test does not mean you can give up routine screenings. We still want people to know their cholesterol levels. We still want people to do their mammograms on time. We still want people to visit their doctors on time.
Now, Amanda, Crystal knew she had possibly a connection because of her father, but often, as you mentioned, to reiterate, sometimes that's not the case. People might not have a family member who had a disease like that.
Correct. Yeah, we've seen quite a few people that it was a bit of a shock to them to get these results. They maybe had a family history, but it was in distant relatives, nobody close. So it definitely can be a shock to some people.
And the BRCA gene is responsible for how much in terms of breast cancer and ovarian cancer?
So about 5 to 10% of cancers are hereditary, where we can identify a genetic cause. Ovarian cancer, the percentage is a little bit higher. It's more like 15 to 20%. And the BRCA genes or BRCA genes make up probably a majority of hereditary breast and ovarian cancer.
Well, all right. How's this been going so far?
Yeah, I think pretty well.
I think it's a huge success. And it's a success across the country. So WellSpan has done a great job in finding 400 people in 1 year. Probably we're going to find a lot more, and we don't plan to end the project at the end of 4 years. That's just the current horizon.
We talked about the samples and the information, the anonymity of it or the protection of it. Is that going to stay around, and what if, technology changes in the future?
Well, one important aspect of our program that's different from the other programs is that we store all of the genetic information digitally, and that will enable us as clinicians to go back into the electronic record, and if there's a question about a genetic problem, we'll be able to query the computer and say, does this patient have this other problem? And that is a real bonus because another saliva sample or blood sample won't be necessary.
Oh, so it does kind of stay out there.
Right.
Crystal, did you have any concerns about, your information being out there and people knowing about it possibly?
It seems like, everything that you go through to the doctors, they put all kind of safety mechanisms into it. So I felt, adding it into it wasn't just going to go out there. It was going to be safe.
And as we heard, there is a law that protects people in terms of their insurance and their employment. How does this kind of testing differ from what people might be doing on their own with, say, 23andMe or those types of companies?
So this testing is, it is considered a research study, but it's more clinical testing. So it's looking at individual genes. Now there is the other part that looks at the ancestry. And some of these other companies do a little bit of the same genetic testing, but they're not reporting out the same amount of mutations because there are hundreds of changes in these genes that are harmful. So some of these other companies don't report out all of them. So it's almost like a false reassurance to some people.
And also Helix is what's called CLIA approved, which means the results that come back we're confident in them enough to be able to make clinical decisions. Not the case with the other groups you mentioned.
Now, I know you did this testing as well. Anything surprise you?
On myself?
Yes.
I did not have any variants that they report back on.
And Crystal, did anything surprise you? Obviously, the BRCA gene was something, but anything else that you learned?
I just thought it was really neat, the first part, that, where it was like to find out, it was kind of like it read like you into a person down to the cellular, as I mentioned before, like if you tan versus burning, caffeine, how do you, some people can drink an entire cup of coffee and not have the jitters. Other ones like me, it says that I don't metabolize caffeine very well. And I knew that just from trial and error.
Right, your experience. Now you know for real, right?
So you had mentioned about the future. I think, the future is now. We just need to implement what we already know. We have the ability to insert genes and cure diseases. There's something called polygenic risk scores that take into account not just a single abnormality, but several hundred. And if you have a high polygenic risk score, you're more likely to have the problem than not. So that in cardiology, if you have a high polygenic risk score, you're equally likely to have heart disease as a person with this familial hypercholesterolemia, but there are 20 times as many. So the future really is looking at polygenic risk scores, and we will be able to do that in the not too distant future.
The future is almost now, right?
Exactly.
Well, thank you all for being here, and thank you for sharing. Really interesting. Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro, and join us again next Saturday night at 7 o'clock for WGAL 8 in Focus right after NBC Nightly News. And you can watch each episode of In Focus plus WGAL's latest newscast, original programming, and more. Just download the Very Local app and stream for free on Roku and Amazon Fire TV.